Joining me now in the studio is someone who knows all about the roar of the crowd. Silke Sinning is a professor of sports science at the University of Koblenz-Landau. But she's also been a semi-professional soccer player and coached girls' teams. Thank you for joining us. Now, how much would you say that fans really contribute to a team's performance?
There are two ways of supporting your team. On the one hand, when they're moving forward. If the team is already ahead, for instance, and you want to inspire them to more chances on goal. And then when they're behind, when the team needs extra mental support. By the way, in the women's game, fan culture is very attuned to families and kids, and there's an intense connection to the team. The players are also very close to their fans. As you saw in the report, they flirt with the fans.
How much have training methods changed since you were a player?
The methods have been refined. There's much more intensive, individualized training. In the past, there was a focus on coaching the players' technique to give them a feeling for the ball. But now they've got much more of a feeling for that from early on. So you can do more substantial work on individual abilities and talents.
What would you say is more important, physical fitness or technique?
Without technique, there's nothing. But when you play in a tournament with several games in a row, you need a good constitution. You have to be fit. Of course, you can also achieve strength through technique. You can do a lot of exercises, stamina exercises with the ball.
Silke Sinning will be back with you in just a moment for more. But first, one of the worst things that can happen to men or women players is an injury. The anterior cruciate ligament, also called the ACL, is one of the 4 major ligaments of the knee, and women are 5 times as likely to tear it than men. Why that is and what can be done about this injury has been the subject of a lot of research. Here's what the scientists found out.
Some matches end in the emergency room.
I was trying to dodge my opponent. I tried, and then I twisted my knee.
Did it hurt?
Yeah, it hurt a lot at first. I also heard a noise like something tearing.
The doctors at the Regensburg University Clinic are specialized in soccer injuries, and they certainly don't lack for patience. Hannah will be operated on immediately. She's torn her anterior cruciate ligament, or ACL. The surgeons want to replace it straight away. The patient's gender determines how exactly they do it.
There are different techniques when it comes to the choice of tendons. In women, we look at the musculature to decide which tendon to use as a replacement. We know that relationships of the muscles on the front and back of the leg vary in women, and we take that into account.
The team performs around 250 of the operations a year. Long-term studies show that the knee remains more stable if 2 cruciate ligaments are replaced. However, replacement surgery won't protect players from re-injuring the knee. Torn ligaments remain the most common injury in soccer, especially for female players.
Women are 5 times more likely to injure their ACL than a male player is. The expected rise in interest in the sport among women due to the Women's World Cup and the fact that more women will be playing soccer afterwards means we need to develop prevention programs. In other words, we need to develop ways of helping women avoid ACL ruptures.
And that's what sports science researchers in Freiburg are working on. In the lab, they're trying to determine why soccer can be so hard on female players' knees. They've discovered that women have less strength in their knees and softer connective tissue. Women players also move differently than their male counterparts, especially when they jump. Landing can cause major problems.
A woman's knee joint is rotated inwards more than a man's is. An orthopedic specialist would talk about a valgus deformity, meaning women's knees can buckle inwards, and that, of course, puts a great deal of strain on the frontal plane of the knee joint.
Soccer shoes specially designed for women could help. Smaller and lighter, they also have a different sole. The phenomenon that can cause problems is at the contact point between shoe and field, the shoe's traction. Women's shoes should have less of it than men's do.
When the stopping traction or force is too high, it can place a huge strain on the joints. We can't talk about good traction. What we need is to find the optimal traction for an individual athlete's musculoskeletal system. That's what we need to be aiming for.
In addition to special shoes, the sports scientists also recommend that women go through a different training regimen.
This is the hamstring musculature. These flexors insert here under the knee joint, and it's their job to draw the calf up and back. If they are developed sufficiently with strength training, they then can perform that task well and lower the mechanical strain on the ACL.
Above all, it's the right kind of training that helps players avoid tearing ligaments in the first place, or aids recovery once it's happened. Hannah's surgery went well, but it'll be weeks before she can even consider returning to the pitch.
And we're joined again in the studio by sports scientist Silke Sinning. There's talk of expanding the women's competition at this point to include even more teams. But are there enough world-class teams out there?
Not now. We're seeing the best 16 teams here, with 2 or 3 more approaching that level. But playing with 24 teams in 4 years' time, as FIFA wants, will be difficult. But the support will help women's football develop globally. Overall, FIFA is doing a very good job there.
Who is your favorite to win the 2011 competition?
Germany, of course. They'll be in the final. And I hope they'll be the ones holding up the trophy. They're certain to get very far, and they'll probably also carry the final. But it's not going to be easy.
Women's soccer has really struggled to gain acceptance in Germany, but would you say it's become more popular since you were a player?
It's definitely become more popular. When I started 30 years ago, we had to organize teams just so we could play each other. These days, the girls come along to the clubs on their own and ask to be given a place, to be given balls, to be assigned a coach. It's arrived in society here. Every father is proud to see his daughter playing football. It's great.
And that's the way it should be. Silke Sinning, thank you so much for joining us here today.